Welcome, Excellencies, colleagues, members of the press, ladies and gentlemen. Thank you for joining us for this high-level side event at the 76th United Nations Assembly, partnering to get back on track AIDS by 2020. An exceptional list of speakers with us today, and in the next 90 minutes, you'll hear from heads of state, heads of United Nations agencies, the leadership of UNAIDS, PEPFAR, and the Global Fund, and civil society. I'm Victoria Rubadiri, and I am a broadcast journalist based in Nairobi, Kenya. Now, for over a decade, I have been covering a plethora of stories across Africa and moderated critical conversations on how we can move the continent forward. I'll be guiding you through today's event, which will focus on how we can leverage what we have learned about tackling pandemics over the course of the AIDS response, and how that can be leveraged today for COVID-19 and for future pandemics. We'll focus on the powerful partnership between UNAIDS, PEPFAR, and the Global Fund, and the three co-hosts of today's event, and how they work closely with countries and communities. Together, this partnership has saved millions of lives around the world. We'll also talk about how the intersecting pandemics of COVID-19 and HIV have blown us off course to end AIDS by 2030, and what can be done to prevent a resurgent AIDS crisis. We'll also look at how the AIDS response is mobilizing to fight COVID-19. Finally, we'll examine the change needed to reach the people still being left behind. We have a packed agenda, so I'll introduce our first speaker, Winnie Byanyima, the Executive Director of UNAIDS and Under Secretary General of the United Nations, a leading global voice on health, human rights, and inequality, who will set the scene for today's discussions. Winnie, the floor is yours.
Thank you, Victoria. Welcome, friends. We gather today facing colliding pandemics of HIV and COVID-19. In one of the most challenging moments in the history of HIV and global health. Amidst unprecedented global disruptions, we must act urgently to prevent a resurgent global AIDS pandemic and to quickly recover our progress towards ending AIDS. Together, we have the global partnership of UNAIDS, the Global Fund, and PEPFAR, and we are ready for that challenge. We have learned a lot about how to fight pandemics. 40 years ago, the first cases of AIDS were reported. 25 years ago, the joint United Nations program on HIV/AIDS was created. And 20 years ago, the Global Fund was born. Today, we are going to need every asset of the collaboration between our three institutions, the UN, PEPFAR, and the Global Fund. We will need every asset of our collaboration with governments, with communities, to fight the inequalities that are driving both HIV and COVID-19. That includes bold political leadership, global solidarity, as there was 25 years ago, strategic partnerships that engage the people most affected by the disease, a commitment to human rights, and a serious global plan. With these tools, we have achieved what many once said was impossible. Of 38 million people living with HIV today, 27.5 of them are accessing life-saving antiretroviral therapy. We have cut the rate of new HIV infections by more than a half and averted 16.6 million deaths. Let us be clear, fighting a pandemic with no cure and no vaccine is hard. Hundreds of thousands are still dying of AIDS, and 1.5 people were newly infected last year, most of them young people. AIDS remains a crisis, and COVID-19 is making it worse. The good news is that our partnership is strong and flexible. Our data show that even during massive health system disruptions under COVID, most people living with HIV, most of them who were on treatment or on PrEP, have been able to stay on. That's an achievement. The key has been innovation on everything from multi-month dispensing of drugs to new community-led models of care. But the threat of an AIDS resurgence is real. Our data also show that in many countries, fewer people living with HIV are being diagnosed and fewer are starting HIV treatment. HIV prevention services have been disrupted. New data from San Francisco shows a drop in HIV viral suppression. This doesn't bode well for less wealthy cities around the world. And the burden is falling unequally. For example, men who have sex with men who depend on gay-friendly services have experienced some of the most important disruptions. Even young girls, we have reports that the threat to progress against child marriage and that COVID is threatening the progress we've made on child marriage. We also know that globally, 10 million more girls are at risk of early marriage in the next decade. The shadow pandemic of violence against women is worsening. The demand for gender-based violence services increased fivefold in some countries at the start of COVID outbreak. So the impacts are being felt, the disruptions are being felt differently. Many of those responding to HIV are the very same people who are fighting on the front lines against COVID, tracing contacts, building community services, and defending rights in the pandemic. But we can get back on track for HIV and build pandemic resilience communities, even in the face of all this. The political declaration from the General Assembly last June focuses on tackling the inequalities at the heart of today's HIV pandemic, using data to identify where the inequalities are and making concrete strategies to close them. Taking seriously how the intersections of gender inequalities, discrimination against key populations, income inequality, inequalities in voice and power, how all this varies from community to community and designing responses to meet those differences. This work is harder. It's not easier and will take bold financing efforts. We need to get cutting-edge science to the people who most need it. We got here by ensuring generic production of ARVs in Africa, in Asia, and Latin America. Now, the next generation of AIDS drugs and COVID vaccines must follow the same path. Wealthy countries are talking about a third shot, a booster shot of COVID vaccines, while in Africa, less than 4% of the population is fully vaccinated. This sounds too much like the early days of AIDS. It is not how to fight a pandemic. We must be serious about community-based and community-led services, funding them sufficiently to be the front line against stigma and to boost health systems. Human rights must be at the center of pandemic response. I'm concerned to see shrinking civil society space and growing threats to human rights, even as AIDS and rights activists inspire me with their actions. So friends, I say here that we will deepen this partnership between the UN, with our 11 co-sponsors, the Global Fund, PEPFAR, government leaders, and communities. I affirm it. We have learned how to fight a pandemic, and so many are counting on us to prevent a resurgent AIDS pandemic and to contribute to ending this COVID pandemic too. Thank you very much.
Winnie, thank you for your inspiring insights, for your leadership as well, and of course for co-hosting today's event. Now, it is my honor to share a special video from His Excellency Felix Antoine Tshisekedi Tshilombo, the President of the Democratic Republic of Congo and the Chair of the African Union. Now, please note, his remarks will be in French, and so by clicking on the world icon at the bottom of your screen, you can access the English or Spanish translation.
Madame la directrice exécutive de l'ONU-SIDA, Monsieur le secrétaire général des Nations Unies, Monsieur le directeur général de l'OMS, Madame la directrice exécutive de l'UNICEF, Monsieur le directeur exécutif du Fonds mondial, Madame la coordonnatrice ad intérim du PEPFAR, distingués invités, l'honneur m'échoit à ce jour de parler au nom de mes pairs africains en ma qualité de président de l'Union africaine à l'occasion de cet événement de haut niveau sur les avancées en matière de lutte contre le VIH-Sida sur notre continent en marge de la 76e session de l'Assemblée générale des Nations unies. Nous sommes à un tournant décisif et crucial de la riposte au VIH-Sida, comme l'a si bien souligné Madame la directrice exécutive de l'ONU-SIDA, 40 ans après l'annonce du premier cas du VIH. En effet, comme vous le savez, l'Afrique porte un lourd fardeau, avec plus de 68% de malades sur les 37,7 millions de personnes vivant avec le VIH dans le monde. En 2020, environ 61% de nouvelles infections à VIH sont survenues en Afrique et le continent paye aussi un lourd tribut avec 68% de décès dus au sida. Madame la directrice exécutive de l'ONU-SIDA, distingués invités, en une décennie, 2010 à 2020, des avancées importantes ont permis d'avoir un impact avec la réduction de nouvelles infections et de décès, avec respectivement dans les régions africaines, en Afrique de l'Est et en Afrique australe, moins de 43% de nouvelles infections et moins de 50% de décès. En Afrique de l'Ouest et en Afrique centrale, moins de 37% de nouvelles infections et moins de 43% de décès. En Afrique du Nord, plus 25% de nouvelles infections et moins 26% de décès. En Afrique, c'est respectivement une réduction de 41% dans les nouvelles infections à VIH et de 47% dans les décès dus au sida en une décennie. En outre, en 10 ans, le nombre de personnes vivant avec le VIH sous antirétroviraux est passé de 5 millions à plus de 19,5 millions de malades. Je voudrais saluer ces performances obtenues notamment avec le concours technique et financier des Nations Unies sous le leadership de l'ONU-SIDA, du Fonds mondial, du PEPFAR et d'autres partenaires. Mesdames et messieurs, distingués invités, comme vous le savez, dans l'ensemble, l'aide internationale en matière de VIH a diminué de près de 10% de 2015 à 2019, le soutien de quelques donateurs augmentant, tandis que de nombreux autres ont réduit leur financement pour le VIH. La reconstitution réussie du Fonds mondial en octobre 2019, l'appui financier solide et soutenu des États-Unis d'Amérique au PEPFAR et l'appui essentiel fourni par la Banque mondiale aux dépenses sociales sont des preuves encourageantes de la solidarité mondiale qui subsiste en faveur du financement de la riposte au VIH. L'Afrique a encore besoin de la solidarité mondiale et je profite pour souhaiter un bon anniversaire à l'ONU-SIDA, au Fonds mondial et au PEPFAR qui célèbrent respectivement leur 25e, 20e et 18e anniversaire et dont le soutien a été déterminant. Mesdames et messieurs, distingués invités, il vous souviendra qu'à l'occasion de mon adresse à la tribune des Nations Unies en juin 2021, j'avais marqué l'adhésion de l'Afrique à la nouvelle stratégie de l'ONU-SIDA qui vise à mettre fin aux inégalités avec l'ambition d'atteindre l'objectif 95% en fin 2025 et de mettre fin au sida comme problème de santé publique à l'horizon 2030. Ainsi, parlant de la responsabilité partagée, déjà en octobre 2019 à Lyon, l'Afrique a massivement contribué à la reconstitution des ressources du Fonds mondial avec 23 pays africains qui ont fait des promesses pour un montant de 75 millions de dollars. Ceci constitue incontestablement un signal fort de l'engagement du continent africain dans la riposte contre le VIH-Sida. En plus, l'Union africaine a décidé cette année de créer une agence africaine du médicament pour mettre fin à la problématique d'accès aux soins. Cela sous-entend le VIH, la COVID, l'Ebola, toutes les maladies négligées et émergentes. Mesdames et messieurs, distingués invités, malgré ces progrès de la réponse au VIH, il subsiste néanmoins des défis majeurs tels que la prise en charge pédiatrique des enfants séropositifs, les décès et les nouvelles infections, la couverture en charge virale qui reste encore faible avec plus d'un tiers de personnes vivant avec le VIH en sigle PVVIH, qui eux n'y ont pas accès. Des millions de personnes vivant avec le VIH et des personnes à risque ne bénéficient toujours pas de services vitaux de prévention, de soins et de traitement du VIH. La discrimination, la stigmatisation, les violences basées sur le genre qui plombent les efforts des États et limitent l'accès aux services de santé. Il en est de même des barrières juridiques et du respect des droits humains, notamment des populations clés qui limitent leur accès aux services VIH. En Afrique subsaharienne, des taux élevés d'acquisition du VIH persistent chez les adolescentes et les jeunes femmes en raison de vulnérabilités multiples telles que des normes et pratiques sociales néfastes. La prise en compte d'autres maladies, notamment la COVID-19, qui impacte sur les ressources allouées à la lutte contre le VIH-Sida. Le financement et l'accompagnement technique des organisations de la société civile qui jouent un rôle important dans la mobilisation communautaire et la réponse aux maladies. La pauvreté et le manque d'éducation constituent également d'énormes obstacles pour délivrer les prestations de santé et de lutte contre le VIH. Mesdames et messieurs, distingués invités, voilà maintenant 40 ans que nous luttons contre le VIH. Les succès et les échecs nous ont appris que nous ne pouvions pas nous préparer à une pandémie ni la vaincre sans dissoudre les inégalités, promouvoir des approches centrées sur les personnes et basées sur les droits et sans travailler avec les communautés pour atteindre toutes celles et ceux qui en ont besoin. Une fois de plus, nous comptons sur nos partenaires traditionnels, le Fonds mondial, le PEPFAR, les Nations Unies à travers l'ONU-SIDA et les autres, pour nous accompagner afin d'être au rendez-vous des objectifs de développement durable en 2030 et gagner définitivement le combat contre le VIH-Sida. Je vous remercie.
We are certainly grateful for His Excellency's leadership and, of course, the leadership of the African Union in addressing inequalities and fighting pandemics in extremely challenging environments. Well, AIDS-related deaths in DRC have declined by 61% in the last 10 years. That's some good news, and the DRC is leveraging its considerable expertise in responding to many health challenges like HIV and Ebola, and is applying these lessons to respond to COVID. Now, with mounting challenges, the DRC and the rest of the AU need global solidarity now more than ever. Well, next, I'm going to hand over to my colleague, Regan Hoffman, who is the acting director of UNAIDS US Liaison Office. Regan will moderate the first of our live panels in New York today and introduce a short film with a special message to world leaders. Over to you, Regan.
Thank you, Victoria. And it's a pleasure and an honor to be here. Thank you both, Winnie, and for coming back, and Anjali for joining us today here in New York. Before I begin.
Yeah, thank you, Regan. We understand that there will soon be a formal announcement of President Biden's nomination for the US Global AIDS Coordinator. And so I'd like to take the opportunity to thank you very much, Anjali, for guiding PEPFAR through the transition between administrations and for being such a great collaborator with us, and look forward to continuing to work with you.
Thank you so much, Winnie. I really appreciate that. And again, the partnership that we have together from the United States through PEPFAR, with UNAIDS, and with the Global Fund, together with our countries and communities, will continue to be strong. We look forward to our administration's announcement when the time comes. But again, the partnership will continue to be strong. So thank you so much.
Thank you both. So Anjali, I'll pose the first question to you. We've seen remarkable progress against HIV over the last 40 years, in particular the last 20 years, but some countries have achieved epidemic control. Others are nearing that threshold and others are not quite there. So we'd love to hear from you about how COVID is impacting the work that's being done and what kinds of actions PEPFAR is taking to remediate or to help continue the progress against HIV in light of COVID-19's impact.
Great. Thank you so much, Regan. And again, it's so wonderful to be here with all of you and to really feature and talk about something that we all have a collective responsibility in and can celebrate together as well. We have made tremendous progress together. And that is something that we need to continue to drive forward. As you noted, we really have, as a globe, made incredible progress, just as the president of the DRC noted as well. In DRC, we've also seen with some of the global figures that Winnie presented earlier, we are making tremendous progress. I would say that there are three critical areas that really help push us and drive us toward progress. And particularly in the time of COVID-19, and that has been programmatic focus, powerful platforms, and unwavering persistence. And all of that is only possible through partnership like we have, like we share, and that we must continue. The past 18 months have been devastating, right? We've all been impacted by COVID-19 in ways we can't even begin to describe. But that hasn't stopped the progress and the commitment that we have for HIV. Together, and really since March of 2020, we've been working very, very hard to make sure that we can continue with a programmatic focus, continue leveraging our platforms to do two things. One, to continue services to the people we serve, make sure we can keep those gains, protect those gains, but accelerate those gains in the wake of COVID. But two, leverage these incredible capacities and capabilities that exist in countries and communities, what we call the platform, really. It is public health and clinical and community services and systems that enable us to be nimble, flexible, to continue to deliver services, particularly in the wake of COVID, as I noted. So again, I think, coming back to the final point of persistence, COVID-19 has shaken us all, but with adaptation, with innovation, with policies that have really moved in weeks versus months and years, like we've seen from countries and communities, we've been able to drive forward. Now we have, even just in the past six months, we've increased treatment by over 1.2 million from where we were, even in the wake of COVID. We've increased circumcisions to prevent new infections among young men. We've doubled PrEP among adolescent girls and young women. These are successes that we can all share because we've been nimble and we've had a strong partnership, Winnie, as you noted earlier.
Thank you. Winnie, you reflected in your opening remarks on the need to apply the lessons of fighting HIV to COVID. This is a remarkable moment. We have a lot of knowledge from our 40 years fighting AIDS. So how can we use what we know from HIV to inform how the world thinks about fighting pandemics and also our future response? And of all the critical lessons that we've learned fighting HIV, what do you prioritize as we think about going forward in the world and stopping pandemics, HIV, COVID, and beyond?
Thanks, Reagan. I have to say that the role of communities in the HIV response is one of the keys. The healthcare system plays a critical role in fighting a pandemic, whether HIV or COVID. But what we've learned from HIV is that where there are strong, organized communities surrounding the public health system, then that's when we succeed. You need to have the communities there. So what do I mean by that? I mean, first, that you need community-based health workers. These are critical. When they are well-trained, well-equipped, when they come from the communities that they serve, they can be that bridge that builds trust between the health facility and the people and the communities themselves. So community-based health workers that are empowered. Secondly, community organizations. Those community organizations that are able to provide community-led services. We talk of services, but we also talk about community-led services. These are critical too. They make a difference because it is people who are concerned, who are affected, delivering services for themselves. Makes a huge difference. Then, I mean, community-led monitoring efforts, such as those that PEPFAR has pioneered, and we've been working with them, say, in South Africa. Here, you have a shift of accountability. You have the duty bearers being held accountable by the rights bearers. So this is critical when the accountability is led by the people themselves who benefit from those services. This is what we mean by putting communities at the center. And then lastly, community groups that are there to fight for human rights, because human rights must be central. And without that environment of the human rights of everyone being respected, you cannot win against a pandemic. I'm very worried today to see shrinking civil society space and less funding going to community-based organizations, human rights organizations who do this work. So I see, of course, that when it comes particularly to key populations and people living in urban, poor areas, that this is where we need the strongest community responses. And this is where our challenge is, because the HIV pandemic is growing mostly amongst key populations and in areas such as poor urban areas. So communities, human rights. These for me are the big keys that we need.
Thank you. Thank you so much. Anjali, the healthcare infrastructure, healthcare workforces, labs around the world supported by PEPFAR and the other partners, and of course the countries themselves, are being leveraged to help with COVID-19, which is a good thing. But we also want to continue to make progress against HIV and protect the people that we're trying to prevent from getting HIV and help them if they've contracted HIV. So how is this working in the field, and how do you both leverage what you've got with PEPFAR without, preventing forward momentum on HIV?
Thanks. That's a really important question, particularly now as we have, we're really fighting dual pandemics, right? As many of you know, we, through PEPFAR, we have invested $85 billion in the global HIV response. That is tremendous. But what's important is that a part of that investment, a significant part of that investment, about $1 billion every year, has been on these health systems that you describe. And I want to be clear that it's not just infrastructure, lab, surveillance systems, supply chain, which are critical and part of the health system. It's the healthcare workforce. It's community health workers, as you note, Winnie. These are really critical, important pieces to delivering HIV services, but also, as we've learned, delivering COVID-19 services. We cannot afford to dilute HIV services by only focusing on COVID-19. But what I think is important to relay is that there's definitely synergy that's possible when leveraging these health systems and community health workers, healthcare workers, laboratories for HIV specifically, but also for COVID-19. And I'll give you a couple of concrete examples so you can see how this is actually going at the community, at the country level. So for labs, for example, these are PEPFAR-supported, country-led laboratories. We support over 3,000 on the continent of Africa alone, for example. These labs and lab systems have been leveraged to continue to not only do HIV testing that is critical and we must continue, but having the system and the laboratorians and the supply chains readily in place has enabled us to quickly been able to move and do COVID-19 testing. Mm-hmm. Community health workers, for example, are great examples across the globe. But what we've seen are community health workers that are critical to ensure ARV adherence is happening among the people we serve. We're also seeing community health workers continue to go door to door at the community level, making sure ARV adherence is occurring, but also doing COVID screening at the same time. We need to protect the people we serve. We can't silo people. They are not just HIV people or COVID people. These are people. These are examples of how we are leveraging the platform that I described earlier to both continue to advance HIV services while also smartly investing and supporting in broader pandemic responses.
That's great. Thank you. And it's also so true. We have to keep viral loads down because otherwise we've got all these people who've been on treatment. And if their treatment is interrupted, obviously that doesn't help them personally or our work on AIDS. So Winnie, you've already referenced the work that's been done to bring lower priced affordable medicines to the world. We did this with HIV over many years through many battles. And it's been a key part of the response to get that affordable, high quality medicine in low and middle income countries. How do we think about that in terms of COVID? How can we leverage those learnings going forward with COVID, vaccines and also treatments?
Mm-hmm. Yeah, one of the most important lessons from the AIDS response is that we have to get the best science to all the people who need it most, all of them, not some of them. When HIV drugs first came on the market, the antiretrovirals were costing $10,000 per patient per year. For people in the developing world, I was in Uganda then, it was completely out of reach. And people were continuing to die because our countries could not afford that. Only a handful of companies were producing these antiretrovirals and they were keeping their price there. But today, we have high quality HIV treatment that is just $75 a year, from $10,000 to $75 a year. That happened because there was a concerted effort by the UN, by activists, AIDS activists all over the world, and by governments to shift towards global generic production of the antiretrovirals. PEPFAR was a leader in this. When you switched to buying generics, when PEPFAR switched from buying the brands that it was buying here in America to buying generics, the program saved billions of dollars, and these were reinvested to scale up treatment amidst budget constraints. So we got to $75 a year through a partnership. Different stakeholders, AIDS doctors and activists put pressure on companies. That's why we are putting pressure on companies today, or COVID companies. Low and middle income countries, the governments used the flexibilities in the WTO TRIPS agreement in order to push for generic competition. They pushed for exceptions to the WTO rules on intellectual property to enable them to produce. Groups like the Clinton Health Access Initiative helped to broker deals between the vaccine, the ARV technology holders and companies in the South. The medicines patent pool helped to overcome the intellectual property barriers. That's the pool at the WHO. And funders moved to buy generic AIDS drugs. All this helped to bring prices down and for medicines to reach everyone. Pharmaceutical companies also saw that they now needed to offer licenses and do technology transfer to other regions. It didn't just happen, but it was all this pressure and developments around them that made them then share their technology. Today, it's become commonplace that major HIV drug makers introduce their new products together with licenses for southern companies to produce more for the market. This is now more common with HIV, but it's not yet happening with COVID. So all this new system that has come, has evolved out of HIV is not perfect. We know some middle-income countries are not getting products at the right price for their people, but it is saving lives. And we can talk about 27.5 million people who are on lifelong, who are on treatment, they're living healthy lives, and they come from these very poor countries. So this model that made HIV drugs globally available is still not being used for COVID-19. The success story is there, but it is not being repeated in this case. It's also not being mobilized for some of the newest HIV treatments too. For example, the long-acting formulations that could actually save the lives of, say, adolescent girls, young women, criminalized gay men who hide to go to, who have to find ways to get their treatment, a long-acting and injectable ARV that lasts 6 months could give them a chance to adhere and live a good life. This is not being produced yet in enough quantities to benefit everybody in the South. So we still have work to do even for HIV in terms of making the science reach everybody who needs it. So you could get a company, for example, like Cipla in India, which produces ARVs, or Aspen in South Africa. They could be making these long-acting antiretrovirals if they had the recipe for it. They have the know-how, they have the people who can do it, they have they produce other drugs, so they have an infrastructure, but they need the recipes. So companies and governments in Africa, in Latin America, and in the Caribbean let's be clear, they have the expertise, they have the funding. What we need to have is sharing of technology and know-how. This is driving huge inequalities, the lack of sharing, and it's undermining our HIV response as well as the COVID response. This lack of sharing technology and know-how. So we can do better there. And your question, I would say there are two answers to it. One, that we've made a lot of progress with HIV on getting the science to reach everybody, but we still have a road to travel on HIV, and we certainly are facing a huge challenge with COVID. We need to move in the right direction.
Thank you. And as someone who's taken the pills for 25 years, there's a big difference in the type of medicine, and that really impacts how you're able to take the medicine. And so, as you say, these long-acting injectables would solve so many problems for people and get around some of the social barriers that we face, people living with HIV. So thank you for that. We're a little short on time, so we're going to go quickly to the last question. Anjali, just a quick point, if you may, on how we work together in the field. We've got this triumvirate of really powerful organizations. We've been working together a long time. We've made great progress. What's the secret sauce? How does this work?
So I think just right off the bat, I would say nothing is possible without partnership, full stop. And the partnership that we have between PEPFAR, the Global Fund, and UNAIDS is absolutely essential. But the reason it's so essential is because we work hand in hand together with countries and communities, private sector partners, other multilateral organizations, community groups, to really make this happen. It all has to come together where the rubber meets the road, where the people are, where the clients are, where the communities are. So I think the secret sauce of the partnership between us is that when we are aligned at the strategic and policy levels, it's essential. That is essential to ensure that we're aligned at the programmatic implementation level. This is where people are. This is where we need to work together. So I think, we value, and when we come together as we have over nearly 2 decades, we've been able to do the impossible together. I mean, it's extraordinary to see the progress that's been made, these epi curves driving down, countries getting to epidemic control without a vaccine or cure. It's unprecedented, but what's essential also are complementary strengths that we each have and bring to the partnership. Additional complementary funding so that we're making sure we're not duplicating, but complementing each other. Work at the global data level, bringing that global data to bear so that we can make sure we are best representing at the community and country level. These are things and ways, policy movement, the way we work with communities, that's an essential piece that UNAIDS also helps bring to the partnership. Lifting up communities, ensuring that we're working together to translate that policy from the national level down to the community level where it matters, lifting up communities to making sure their voices are heard, that they are part of the delivery of service and monitoring those services. So quickly, I would just say nothing is possible without partnership, and it has been such a privilege and honor to be in this partnership together with UNAIDS and Global Fund and the countries and communities that we serve together.
Thank you. That's an amazing answer and true. And Winnie, the final word to you. You're a global leader on inequalities, and what we're facing in HIV is this gap between people who can get access to life-saving medicine and prevention and people who can't. So the global strategy, the new one, is based on inequalities and addressing them, ending them. What do we need to do? Why is it so important?
Yeah, inequalities are at the heart of this problem, and unless we reduce those inequalities, end them, we will not end AIDS. 27.5 million people today are on treatment, living healthy lives. Another 10 are not. Why are they not? In many, many countries, in different regions of the world, you can see patterns. You see that in some regions, it is gay men, transgender people, sex workers, It is people who inject drugs in other regions. And in Africa, it is very much adolescent girls and young women. All of those have something in common. There are intersecting inequalities that prevent them from accessing what science has to offer, whether for prevention or for treatment. It is the inequalities that they face that stop them from being part of the 27.5 million. So we must tackle those inequalities. In many countries, if you are a gay man, you are a criminal. You are criminalized for who you love. If you are transgender, you're a criminal because of who you are. Sex workers, the job they do. So if this legal policy environment is changed, then they can benefit from services just like anybody else. So we have to tackle those inequalities that lie in social norms, that lie in social structures, that lie also in economic structures. Most of the people we are talking about who need to be reached live in poverty, live without shelter. So reaching people where they are and reducing the inequalities they face is critical to ending AIDS, and may I say also ending COVID.
Thank you both so much for your amazing insights. We also will hear from Peter Sands later in the program, our other co-host for the event. He will be piping in live from London. So I'm going to turn it back to Nairobi, to our colleague there. And thank you both again.
Fantastic, wonderful conversations there. Thank you so much, Regan. And as of now, let's head over to a special video that will be featuring some amazing celebrity voices. Take a look.
To end AIDS, we need to talk about it.
Aujourd'hui, avec la COVID-19, la population ne respecte plus les gestes barrières et ne parle plus du sida.
Le virus est toujours là.
There's one simple reason we're missing our goal: inequality.
In sub-Saharan Africa, 4,500 young women are infected with HIV every week. Not every year, every week.
The stigma associated with it was arguably worse than the disease itself.
Many people are not accessing services out of fear of being recognized or judged, or out of personal safety and security.
Young children in Indonesia were expelled from their schools when teachers and parents found out that they are HIV positive.
This is totally unhuman.
Key populations most likely to become HIV positive are least likely to have access to the services they need to survive.
People who feel disenfranchised and cut off from society. And that's where HIV/AIDS seems to come in and root down most.
HIV does not discriminate. We do.
We've made a lot of progress scientifically and medically, but we still have a long way to go.
Las personas no entienden todavía lo que es un diagnóstico por VIH. Entienden que inmediatamente se le entrega un diagnóstico, ya es el final de sus vidas.
Today, people living with HIV can enjoy long, healthy lives with one pill a day.
Je vis avec le VIH depuis donc toutes ces années, depuis 25 ans.
另外，只要坚持吃药，感染者的寿命也可以和旁人无异。
Whether you live or die from AIDS is still too often determined by who you are, who you love, and where you live.
Malheureusement, la complaisance s'installe et les inégalités se creusent.
Que nous pouvons encourager nos dirigeants à donner les moyens pour stopper cette pandémie.
L'accès à la prévention, au traitement et aux soins reste une des priorités vitales.
We need governments to do their part. We need communities to mobilize and organize. We need civil society to advocate.
We need a recommitment to ending the ignorance, the stigma, and yes, sometimes silence that stands between us and the end of the AIDS epidemic.
It's an achievable dream, but what we have to do is to end the stigma.
J'appelle les leaders du monde entier à s'engager pour un monde sans sida,
to ensure that everybody who's at risk of contracting HIV feels safe, feels loved, and feels they have access to the testing and treatment that they need.
If we work together towards these common goals, and if they are achieved by 2025, it will put the world back on track to end AIDS as a public health crisis by 2030.
Il est important de poursuivre ce combat et de redoubler d'efforts. Il est urgent.
Nous savons comment en finir avec le sida et nous disposons des outils pour y parvenir.
We can stop this. We can stop this.
On peut faire zéro discrimination une réalité pour tous.
Those who understand the need for global solidarity, those whose hearts tell them that the right thing to do is to care for humanity, must organize and win the public debate.
We must continue to give people hope throughout the world. AIDS is on the agenda. We can't leave these people behind. We were all born equal. We all should be treated the same.
Fantastic. Great to see those voices of Sir Elton John, David Furnish, Charlize Theron, and of course, many others who appeared in that film, and for their incredible support. Now, for our next live discussion, we have with us Her Excellency Monica Gingos, the First Lady of Namibia, and Mr. Omar Abdi, the Deputy Executive Director of UNICEF. UNAIDS Executive Director Winnie Byanyima will moderate the discussion. Over to you in New York, Winnie.
Thank you, Victoria. So thank you so much for joining us to explore an issue especially close to my heart. Every week, more than 4,200 young girls in the age bracket of 15 to 24 are newly infected with HIV in sub-Saharan Africa. This is not every year. We're talking about every week, 4,200. And UNAIDS estimates, they show that only 54% of children 14 and younger who are living with HIV are accessing antiretroviral therapy, only 54%. And this is to compare with 74% of adults 15 and over. Two champions fighting this injustice to girls, young women, are here with us today and have been introduced. The First Lady of Namibia, my sister Monica Gingos, her passion to help young people living with HIV is remarkable. As UNAIDS Special Advocate for young women and adolescent girls, Monica has used her influence to bring critical attention to the needs of young women and adolescent girls. And my brother, Omar Abdi, UNICEF's Deputy Executive Director for Programs, is equally committed to helping the world's youth to stay AIDS-free. Admire your leadership. So here's my first question to you, Monica. We know that keeping girls in school through secondary school correlates to lower rates of HIV infection. What is it about having girls in school that helps serve as HIV protection? What is it?
So it's access to information. And if I can take it back to before COVID, and specifically in Namibia, we had very difficult discussions on the ability of adolescent girls to access contraceptives, very difficult discussions on whether there should be sex education in schools. And come along COVID, where young people no longer have access to the school environment. The little sex education that was happening is pulled back. The little contraceptives that they were accessing was reduced by half. What do we see now after lockdowns? A doubling of adolescent pregnancy rates. We seeing, and we assuming that the new infections in this demographic of 15 to 24-year-olds will increase as well. But at the same time, we're also seeing, due to previous policy decisions to make free education available, where more girls were enrolled in school, more girls started to graduate from both high school and university in Namibia. So you see how policy decisions can have a strong impact on good educational outcomes, but we also see how our social, cultural, and religious beliefs impact health outcomes. So yes, good education, bad, allowing adolescent pregnancy to increase, and also putting statistics to these conversations that we were having about sex education. And the proof is now there. When you remove children from a school environment, when you remove sex education from the ability to access information, you compromise education outcomes. So I think the long answer to your question, Winnie, is that it's about access to information. It's about having the information to make informed choices about what impacts your health, your education, and your economic opportunities.
Absolutely, absolutely. And being in a safe space. Now, I'd like to ask you, my brother, Omar. UNICEF has just finalized its new global strategy. How can UNICEF translate this into action to reach all children and address their safety from infection of HIV?
Thank you, Winnie, and thank you for your remarkable leadership of the global movement to end AIDS. Ending AIDS in children needs our collective action to diagnose and link the 1.7 million children living in HIV globally to HIV treatment to keep them healthy and alive. It is encouraging that HIV treatment coverage in children has substantially increased in the last decade compared to that of pregnant women. In fact, as a result of these improvements, the number of AIDS-related deaths in children between 2010 and 2020 fell by 59%. But we still need to do more for children. And that's why our new strategy focuses on HIV treatment coverage in children. To galvanize action for the new global AIDS strategy, UNICEF, along with WHO, we are proposing a global framework to drive commitment and catalyze action. Global action to end pediatric AIDS, to be built on the legacies of the previous plans. One, to fast track the translation of the global targets to country-level targets, define milestones to drive implementation, and to track donor and in-country expenditures for women, children, and adolescents. Secondly, to provide technical support, guidance, and advocacy to countries to strengthen the integrated implementation of HIV with MNCH, including prevention and control of sexually transmitted infections, the sexuality education that the First Lady spoke about, and other relevant programs to provide seamless continuum of care and service delivery that meets the needs of girls and women and their children. And finally, to coordinate and build coalitions in support of country implementation. Thank you.
Thank you so much, Omar. Really, really welcome the partnership on ending pediatric AIDS. It is almost, it's quite a shame that children, that infants have less access to treatment than adults. It suggests that we have left them behind. Let me come back to you, Monica. You are a strong supporter of a new initiative we call Education Plus, and this is about empowering girls and preventing HIV infection by ensuring that they are all in secondary school. And this is an important initiative for sub-Saharan Africa because we know like 2/3 of all children who should be in secondary school are not. And the outcomes we get when girls stay in school up to the end of secondary school across all aspects of the economic and the social benefits are proven. And we need to get them in school, not just to end AIDS or to prevent them from catching HIV, but also to achieve other social outcomes. How would you respond to governments and skeptics who say we can't afford to support all girls and all children through secondary education, what would you say?
We can't afford not to. The impact on societies as a whole, when you have women and girls being left behind, impacts society as a whole. And I think there are countries that have done it. About 5 years ago, Namibia introduced free education until young people finish high school, and the impact on school enrollment, the impact on young people coming back to school, and the impact on graduation levels was phenomenal, particularly on girls. We also, however, noticed how important it is to also keep a focus and an eye and support to boys, because ultimately we cannot put all these programs in place to protect girls and not address the behavior that threatens them. So having boys also in programs and environments where they learn healthy coping mechanisms to whatever is creating risk factors in their conduct towards young girls. So you can't leave the one behind. And in a way, Namibia has been a victim of its success there, because at the largest university in the country, graduation rates are easily 75% female. That creates a new dynamic as well from an education perspective. So it's about balancing the two.
A reverse gender gap can also create big problems. So Mr. Abdi, back to you. Children aren't often able to advocate for themselves. UNICEF has long given voice to the needs of children. What do you want to say today to world leaders about the need to redouble efforts to keep children safe from HIV?
Thank you, Winnie, again, to UNAIDS and your co-organizers for giving us this occasion. So the global goal of ending AIDS by 2030 will not be achieved if we do not draw attention to children and adolescents. We know what to do to catalyze achievement for results and close the current inequities. So we say to governments, you have to deliver on the commitments made by increasing your budgetary allocations for prevention and treatment of HIV/AIDS, and to the donor community to prioritize funding for children especially. To the private sector, we ask them to innovate and develop tests and treatments for pediatric AIDS. And to civil society, we ask them to strengthen our partnerships so that we create the necessary demand and support community-based response to reach more families and children with services. Thank you.
Thank you. Thank you. Now I want to shift to a question that troubles me, keeps me awake at night. That is sexual violence, sexual and gender-based violence against girls, against women. What are the policies and actions countries need to take to address this? It is critical because we know there's a strong correlation between sexual violence and HIV/AIDS infection, HIV infection. What do we need to do? What do countries need to do to address this?
I want to start where you stopped, when you were talking about how if we want to end AIDS, we need to end inequality. And the same is true for sexual and gender-based violence, particularly in countries like Namibia, where we have post-conflict societies with all the trauma that accompanies it. And we're very good at crafting and developing developmental agendas and programs, which do not work funding into the resolution of social issues like addiction, like mental health. And I think it is time that we start prioritizing mental health, substance abuse, and the rehabilitation that is required in post-conflict societies when we talk about our developmental agenda. Another thing that I've noticed is that we often work in silos, whether it's government departments and agencies, as well as their partners, international partners. And I think it's time to break down those silos and make sure that the response is a lot more integrated, because there is a lot falling through the cracks when it comes to addressing sexual and gender-based violence.
And what about toxic masculinities? I mean, the socialization of boys. How do we deal with that? This seems to be very much at the heart of this, but not touched in schools. We talk of comprehensive sexuality education. Do boys get it? How do we deal with it?
So constructing this, this positive masculinity for men has got a lot to do with the presence of active and good fathers. Fatherlessness in a post-war country like Namibia, the absence of fathers is a feature of our society. And to get men to take responsibility for their children, to be present fathers, is going to be critical in adopting these positive masculinities that you speak of. But more than that, I agree, it can go into the CSE program of how do we shape a boy's understanding of who he is and his role in society relative to that of his female counterpart. So there's a lot of work to be done. But I also, and we often say it's also about getting more women into the political arena, which I slightly disagree with. I do think we need more female politicians and policymakers. But I think there are women whose views are very patriarchal and very much about upholding the status quo. So it's the type of woman as well that we need to be very mindful of, because as women, we can also enforce and reinforce patriarchal understandings and masculinities that aren't positive.
Absolutely. And so much more we could talk about, but I know we've run out of our time. So thank you very much, Monica. Thank you, Omar. And back to you, Victoria, in Nairobi.
Thank you. Thank you so much, Winnie. Insightful conversations there with the First Lady and Mr. Abdi as well. Indeed, COVID-19 exacerbated existing problems in our societies, and we certainly need to address those moving forward. Now, our next guest is Ms. Usha Rao Monari, Associate Administrator of UNDP and Under Secretary General of the United Nations. UNDP is a founding co-sponsor of UNAIDS, whose work on HIV, health, and development leverages the organization's forces in human development, governance, and capacity development to tackle the AIDS pandemic. Ms. Rao Monari, thank you for being with us today. Now, could you share with us some insights on the importance of partnerships in ending inequalities when it comes to ending AIDS?
Thank you very much. And thank you very much to all of you for extending this invitation to this important event to the UNDP. Excellencies, distinguished delegates and guests. UNDP is honored to join UNAIDS, the Global Fund and PEPFAR for this important discussion on how we can get back on track to end AIDS by 2030. Before I answer your question, if I may, I'd like to take a little bit of a step back to say that while we've made much progress in the global AIDS response, our work is absolutely not done, and many speakers before me have spoken to that point. The COVID-19 pandemic is disrupting HIV and other essential services, and this is something we are watching very, very carefully in all the countries that we're working in. We are off track to end AIDS as a public health threat. The recent Global Fund results report shows actually a 22% decrease in people getting tested for HIV compared to 2019, and an 11% decrease in people accessing HIV prevention services. From our perspective, we need to act urgently and strategically to protect the gains made in the AIDS response and scale up our collective efforts. As the UNAIDS Executive Director noted in her welcome remarks, I believe, this means addressing the inequalities that for decades have fueled the spread of HIV. And for me personally, as an individual, this is something that I focus on. Gender inequality and other intersecting inequalities, as well as punitive and discriminatory laws, make people more vulnerable to HIV and hinder access to services. And paradoxically, and I was listening to some of the previous speakers, in the context of HIV, it's the most vulnerable who are typically criminalized, suffer human rights violations, and bear a disproportionate burden of the pandemic. Key populations and their sexual partners accounted for 65% of new HIV infections worldwide in 2020. That's a very key statistic that we look at. And for 93% of infections outside of sub-Saharan Africa. Meanwhile, critical HIV services for key populations are unevenly accessible or entirely absent. Those furthest left behind must have access to these services. This means removing human rights barriers to access and reducing stigma and discrimination. UNDP has been supporting 98 countries to do just this. And how have we been doing it? No country can defeat a pandemic on its own, let alone two pandemics. HIV and COVID-19 are showing us that global solidarity, stronger collaboration, and new partnerships with non-traditional actors are needed to safeguard and accelerate progress in this area. The ambitious new global AIDS strategy and 2021 political declaration on HIV and AIDS provide us a roadmap to get back on track. And as reflected in our own strategic plan, UNDP remains committed to work with all partners, including the joint program on HIV/AIDS, the Global Fund and PEPFAR, as well as government stakeholders, civil society organizations, and businesses to make up lost ground. I think this is the key point. I think everybody has to work together, and I don't think anyone should stay apart in terms of their action or their policy. A robust, coordinated approach among all stakeholders is essential to reaching the SDG target of ending AIDS as a public health threat by 2030. I would like you all to count on UNDP as a committed partner in our common ambition to end inequalities and end AIDS. I thank you, and back to you, Victoria.
Thank you so much, Ms. Rao Manari. And indeed, it needs a multilateral effort to ensure that by 2030, indeed, AIDS is no more in this planet. Now, thank you for your insights. We turn to the Director General of another UNAIDS co-sponsor, the World Health Organization, Dr. Tedros Ghebreyesus. Dr. Tedros will share his thoughts on the importance and value of partnerships in responding to pandemics. Take a look.
Excellencies, dear colleagues and friends, 40 years ago, a new virus emerged and sparked the HIV/AIDS pandemic. Life-saving medicines were developed, but the world's poorest had no access to them. Addressing this dire crisis of inequity took more than a decade. The multi-sectoral effort, often led by communities of people living with and affected by HIV, was supported by unprecedented levels of international assistance, UNAIDS, the Global Fund, and PEPFAR. Since then, millions of lives have been saved. WHO continues to work towards accelerating access to life-saving innovations in prevention, testing, and treatment. But challenges remain. Inequities and inequalities in access to services persist, including for sexually transmitted infections and COVID-19. On the 25th anniversary of the UNAIDS joint program, there are many lessons to be learned from this landmark multi-sectoral partnership for disease control. We are stronger when we act together, are mutually accountable, and when each agency brings to bear its comparative advantage towards our common goal of ending HIV. Now, with the global disruptions from COVID-19 and only 9 years to go on the Sustainable Development Goal target to end AIDS by 2030, governments, funders, and multilateral agencies must recommit to this partnership with communities at the center. I thank you.
We thank Dr. Tedros for his insights and, of course, leadership, and for taking the time to participate in this session. Now, as promised, we are delighted that Peter Sands, the Executive Director of the Global Fund, is joining us today live from London. Welcome, Mr. Sands. And of course, the Global Fund has recently issued its results report highlighting the impact of COVID-19 in the fight against HIV, and just showing significant decline in people reached with HIV prevention services and testing. It's not exactly the kind of feature you'd want to come out of a report like that, but how can the world recover from these setbacks we've experienced?
Well, I think the first thing we have to do is acknowledge that there have been setbacks. We were off track against our targets before COVID hit, and COVID has knocked us further off track. The number of mothers receiving prevention of transmission to child treatment dropped by 4.5%. People reached with HIV prevention programs and services declined by 11%. HIV tests taken declined by 22%. And medical male circumcision for HIV prevention dropped by 27%. On the other hand, actually, the numbers of people in the countries in which the Global Fund invests who are on antiretroviral treatment increased by 9%, reflecting, I think, the momentum with which we entered 2020. And also some very determined action, particularly by community-led organizations, to ensure continuity of antiretroviral treatment. But the prevention numbers and the impact in 2020 has to be a matter of significant concern. Now, some of these numbers, as I think Anjali from PEPFAR said earlier, some of these numbers have improved in 21, but in some countries, some numbers have got worse as well. It's a picture of very different and challenging environment for sustaining effective prevention. Now, there's a few conclusions I think we should draw from this. One is it's going to be incredibly difficult to get fully back on track on HIV until we have got on top of COVID. It's in the interest of everyone to get on top of this pandemic and to ensure the continued viability of health systems. And indeed, that's very much the spirit with which the Global Fund has approached its COVID response. So with C19RM, our COVID-19 response mechanism, we designed this to be both about helping countries with the direct response to COVID-19, but also helping countries respond to and mitigate the impact on HIV, TB, and malaria. And thus far, we have committed $3.6 billion to over 100 countries to that task. And that's on top of our core HIV, TB, and malaria spending. But it's not just about the money, of course. I think one of the things, if I think about the things that are necessary for us to respond, I would say, first of all, is we need to ensure we don't take the eye off the ball. We need to continue to be extremely focused on HIV and particularly on the prevention side. And there has been a risk of political and public attention being diverted to COVID. A second is that we need to ensure that COVID doesn't become an excuse for re-establishing and reinforcing the barriers to access to services, human rights related, gender related barriers that we have been working so hard to tear down. And in some places, COVID and the associated public health measures, lockdowns and things have been used as an excuse to further marginalize key populations. And third, we need to take this as a catalyst to accelerate innovation. One good thing I think we've seen in the COVID response is a focus on how we can do things as quickly as possible and how we can ensure that the latest tools, the latest approaches get rolled out to benefit as many people as possible, as fast as possible. Now, we need that in the world of HIV. And indeed, we have seen that with more use of self-testing, PrEP, lots of innovation around remote ways of providing support to people. So I do think we have many of the answers in our hands if we intensify innovation, if we stay focused, if we collaborate effectively. But we should also recognize that the world is going through a tremendous kind of challenge with COVID-19. And what happens with COVID-19 is critical in determining what we can achieve on HIV.
Thank you, Mr. Sands. I just want to take you back to a point you made on how the Global Fund is supporting countries to prepare, because the reality is this is not the last pandemic we'll experience at this magnitude. So what more can the Global Fund do to help prevent similar setbacks? Because it's not a matter of if, but when.
Well, one of the things that I think was very striking about the COVID-19 response was how much of it in so many countries was actually based on the infrastructure and capabilities that had been put in place to fight HIV, TB, and malaria. So you saw molecular testing machines that had been put in place for viral load testing being used for COVID-19 PCR testing. You saw community mobilization mechanisms and community leaders who had played a critical role in the HIV response, pivoting to play equally critical roles in the COVID-19 response. So what we saw was that all that capability, all those capacities that have been developed for HIV, TB, and malaria were of massive value in responding to COVID-19. Now, the reality is we didn't do that intentionally. We and PEPFAR and UNAIDS put these infrastructures in place and supported communities in building capacities to fight HIV, to fight TB, to fight malaria, not with a view to fighting other future pathogens. And I think one of the things we should do differently in the future is have more intentionality about building multi-pathogen capabilities, so that when we invest in capacities for HIV or for TB or so on, we also say to ourselves, what should we be doing on the margin that would make this something that made this health system more resilient to other shocks that might be around the corner? And I think if we do that, actually, we can secure a significant improvement in the resilience of health systems and the ability to detect and respond to new threats on a sort of marginal cost basis. So not diverting from our core mission, but adding greater protection and security. And frankly, even from an purely HIV perspective, building in that greater resilience has to be the right thing to do, because actually the worst thing that has happened to the fight against HIV has been COVID. And we can't afford to have the fight against HIV knocked off course again by the next thing that comes around the corner. So we must build in that greater resilience.
Certainly. Thank you so much, Mr. Sands. It's all the time we have, and of course, great insights to get us thinking about what more can be done to be better prepared. Now, finally, we're going to dive into one of the most important aspects of the HIV response. That's communities and the people who make the work happen on the ground. Communities offer us a powerful reality check, amplifying voices in the fight against pandemics. And we're delighted to welcome Sibongile Nkosi, the co-executive director of the Global Network of People Living with HIV and a champion for social justice. And we welcome her today live from Johannesburg. Welcome, Ms. Nkosi.
Thank you very much.
Wonderful. Thank you for joining us. We know that people living with HIV are at the forefront of efforts to stop new HIV infections, and also to ensure access to medical care and to stop the stigma, discrimination, and violence, and also criminalization that people living with HIV and affected by HIV face. Now, what do you see as the role of community networks in ending AIDS, and how has COVID affected your work in particular?
I think our role as people living with HIV remains the same. We lead and drive the HIV response. We also then inform and support our communities. We are also the champions to the rights of the people living with HIV for a quality life. Together with the key populations, the young people, and the women, we were amongst the first to respond to COVID-19 pandemic, from campaigning against the global vaccine inequity, to getting on bikes to deliver ARVs and food parcels, and to responding to the increase of gender-based violence. We have also led the HIV community response, applying various approaches, including the hundreds of community healthcare workers from the PLHIV sector who have been supporting other people living with HIV to access treatment, but also to adhere to their treatment and supporting them mentally also. The networks have also continued to monitor and document the failures in quality HIV and TB service delivery, as well as the broader health systems in various settings. Community organizations' response systems and advocacy that we've built over 40 years of the AIDS epidemic have been used for the COVID-19. Our communities are ensuring that COVID-19 lessons are integrated, aligned, and monitored to move away from rhetoric into impactful actions. We also continue to hold our governments accountable for their policies and commitments. We, as the networks of people living with HIV, continue to carry the voice of our community, the voice that speaks to the real needs, the priorities, and the tailor-made solutions that we all want. Thank you.
Thank you, Sibongile. And let's talk about just the support that is needed, to be able to play these important roles in the HIV response. What do networks of people living with HIV most need, particularly from governments and other stakeholders?
So what we need from governments is that governments know that without us, you cannot reach communities and you cannot achieve the ambitious goals. Therefore, governments must understand that we are the best allies in the response. We know the struggle, we know the solutions, and we are committed to ending AIDS. So therefore, we actually have the same goals. We also want more than words and commitments. We want to see implementation. For instance, we want governments to make use of the TRIPS flexibilities to ensure sustained access to HIV and other opportunistic infections drugs are available. We want governments and other stakeholders to make it safe for us to do our work, especially in criminalized and hostile environments. We would like each government to establish safe environment for community leaders. It is really the only way for us to know what is needed by community members and to be able to speak up about what the government needs to prioritize. Lastly, we have collaborated with you all to define the path of the HIV response of the next 5 years through the political declaration, the ongoing work with the development of the Global Fund and the PEPFAR strategy. However, we need the same level of engagement to trickle down to national level during implementation. And for this to happen, there must be a commitment of funding for civic space that will allow us as communities to engage in our watchdog roles, to hold all players accountable as we all proposed recommendations for course correction when those are needed. Thank you.
Thank you so much, Sibongile, and thank you for connecting us to the reality on the ground. Now, Excellencies, colleagues, and friends, it has been my honor to moderate this event with so many important voices. We heard today several common themes, including the need for greater urgency in our response to pandemics, the importance of global solidarity behind a data-driven global plan to end AIDS and to end COVID, and the critical role communities play in ending disease, the need to address inequalities, the non-negotiable need to protect human and gender rights, and the power of partnerships such as the one between UNAIDS, PEPFAR, and the Global Fund, and the many partners working with that trio. We also heard how the leadership of countries impacted by HIV and COVID-19 are taking the lead and how communities on the front line must always guide our work. Together, this group knows how to fight pandemics. And as the world looks ahead, not only towards the end of COVID, but also in terms of how we can best prepare to respond to the next threat, we need to draw from the collective experience, the brilliance, value set of the AIDS response. What we need to end AIDS by 2030 is also what is needed to deal with other diseases like COVID. And if we apply the hard-earned lessons of AIDS upfront, we will increase our odds of winning. Thank you to all our guests today, and thank you all for joining us, and enjoy the rest of your day or evening. Thank you.